Any kind of pain, any kind of pain, yes. I think we all have those people, it's kind of it's a big topic. And it's one of the most common reasons why people come to see us, right, is pain. According to the 2024 survey by the U.S. Pain Foundation, chronic pain is a leading cause of long-term disability in the United States. And I found this figure just staggering. This pain cost is for chronic pain, both direct and indirect costs are estimated to be around $635 billion. And that was last year. I can't even imagine what it is this year with everything going on in the world today. So they have assessed that this is more than heart disease, cancer, and diabetes combined. So pain is a real deal here, and it's affecting a lot of people. In 2023, 81 million Americans live with chronic pain, estimated. Chronic pain is more common in women than in men, and it presents differently in women than in men as well. And it increases with age. And this is important because we are seeing an aging population in the United States. There is more elderly in the United States than there has been in any generation or decade. So they're expecting about 82 million seniors, 65 and older, by 2050, which is almost a 50% increase. Of the pain situations, chronic back pain is the #1 reason people come to see us. And it is the #1 cause of long-term disability in the United States. So as the number of seniors are increasing, back pain is going to be increasing, and we're getting a lot more degenerative spinal conditions. And what is the #1 treatment for degenerative spine conditions? Anybody? Surgery, back surgery. But this pain is very resistant to treatment, whether it be medication, injection therapies, surgery, it's very resistant. So what does that leave us with? A lot of people still in pain. They only see about a 30% reduction in their pain, even with surgery. So now we have this wonderful new diagnosis called failed back surgery syndrome. It's an actual diagnosis. You can look it up. And despite all the advances that they have made in their techniques, they are not seeing any further improvements in the outcomes. That should be alarming to people because this surgery is no joke. It's very invasive, it's very impactful on their life, and it is very expensive. It can range from $5,000 to $6,000 up to $30,000 to $40,000 depending on the surgery. And these people are found to have lower quality of life scores, higher levels of pain and disability, higher psychological morbidities, and higher rates of unemployment. So pain management comes in, right? This term pain management, very popular term. We hear it all the time, right? We see it advertised. Big hospitals have pain management specialists, pain management departments. In fact, according to the U.S. News Health, there are approximately 472 pain management clinics in Arizona. Now that's an estimate. There's probably more, probably individuals that have their own clinics doing this work. So what comes to mind when you hear pain management? Well, for me, it means we have to maintain things. We're gonna maintain it at a tolerable level so you can still function, right? You're not getting rid of the pain, you're maintaining it, you're tolerating it. You're gonna have good days, bad days, flare-ups, you might need more medication, you might need advanced procedures or different procedures, you might need to see different specialists. We're gonna treat the symptoms with drugs and surgery and injections, and of course those may change as things progress. When you hear pain management, you might think uncertainty. There's a lot of fear there. What is the lifelong situation I'm going to be in? And how am I going to learn to just live or cope with it? Anyone else something come to mind when you hear the word pain management that I didn't cover? Yeah.
Just wondering, a friend of mine had back surgery about February 3rd, and the L4 and 5,
Yeah.
and she is in so much pain still. She called me the other night, she was crying, and I was like, I don't know what to say, but she has some kind of like a TENS unit, but it's not a TENS unit
Right.
that she uses on her back.
So she's coping.
Yeah,
She's
but
trying to
she's,
tolerate
I guess,
different treatments.
surgeon told her, like, you gotta give yourself a good year, and she's doing a lot of physical therapy, but I was just wondering, I guess it's a pretty severe surgery to have.
Yeah.
Like, she just didn't bounce, she's not bad, she's 55, she didn't just bounce back like she thought she would.
Yeah, most don't. That's
And she
why we're in
doesn't
this
wanna take,
situation.
yeah, she doesn't wanna take pain meds either, unless she has to, so I was just wondering,
Well, we're gonna talk about that.
okay.
I would say the other thing that comes to my mind when I work pain management, I work with veterans, and I've heard enough times for it to be like forefront of my mind, that if I don't get this pain under control, it would be the reason why a veteran would consider suicide.
Yes, yeah,
So I take it very seriously.
absolutely. There's a lot of fear, right? Pain brings fear and it just creates a vicious cycle. Absolutely, thank you. So the other reality of chronic pain is the stigma. There's a lot of stigma around chronic pain, not acute pain, chronic pain. So the physical issue that created the pain in the first place is healed, and now you can't really see the pain, right? But the person is still experiencing pain, and so they're often dismissed. They're often disregarded, and not just by their family and friends, but by their physicians as well. So this has been found to be a significant barrier to treatment. This is keeping people from seeking out the care that they need because that stigma is so powerfully strong. So we have this stigma that they internalize this because they're embarrassed, they feel guilty, there's shame, judgment, and they internalize that, and so they create more pain for themselves, unfortunately, and they get fear around the pain, that concern, and they can lead to depression, suicide, ideation. But this also leads to delayed treatments. It leads to misdiagnosis or not being diagnosed properly, and people are just going to suffer in silence. Like this lady. I don't look sick, thank you. It only took 5 layers of makeup and some heavy painkillers, right? You probably know someone like this. So they're suffering in silence. They're treating their pain and they're managing. So here's a pain management case for you. 18 years and counting when she came to the clinic. 33-year-old female presented with acid reflux, irritable bowel syndrome, constipation, chronic fatigue syndrome, fibromyalgia, restless legs, migraine, headache, depression, neck pain, low back pain, insomnia, PMS, menorrhagia, and probably some other things I didn't list here. So she was taking all of the medications appropriate for those conditions, Prevacid, Elidel, Flexeril. She was on the highest dose of that, highest dose of gabapentin, lidocaine patches, Ambien to help with sleep, and then some over-the-counter things to add to that management. Excedrin for migraines, Tylenol, Advil for anti-inflammatories. Plus she was going for treatments, and she was into alternative care, chiropractic, massage, I should put acupuncture. There was acupuncture, physical therapy, facet joint injections, and other injections. She also was taking supplements. Any supplement her husband found that would address one of these conditions, she was taking it. 30 plus different supplements. And her diet was very restricted. This was my case. This was me. This is where I was at when I found naturopathic medicine. So I thought I was doing all the right things. You know, I was trying to take care of myself and trying to use natural therapies. So why wasn't it working? I was just getting worse and worse. And I felt like a disabled person at 33 years old. That was almost 20 years ago. So what changed? When I found naturopathic medicine, it wasn't about the modalities that were used, right? It was about the philosophy that I was missing. I didn't understand how to apply these things. And I also didn't understand that you could heal. No one had ever told me that. No doctor had ever given me the inkling that I could heal. It was all about managing. You're going to have to manage to your life. You're going to have to learn to cope with it, learn to deal with it. It's all in your head. Just lose some weight, get some exercise. So I didn't believe I could heal. So when I learned about the principles of naturopathic medicine, it completely changed everything for me. And the key principle is your body can heal itself because nature is powerful. Nature can heal. We also, of course, do no harm, so we're working with the body rather than trying to suppress symptoms. We're going to use treatments that work with your body, not just anybody, right? Everybody is different, so we're going to work with the body. Identify and treat the cause. We're going to illuminate why is this happening? What is your story? What have you been through that led you to this point? Because not everyone in pain has the same story. And we don't treat the pain, we treat the person. Doctor is teacher. We're going to educate and empower. That's our ultimate goal. Because we want you to be successful in your own life and to be able to take care of yourself and not have to keep coming back to the doctor. We're treating the whole person, body, mind, and spirit, right? We're not a part, we're a whole. It was very interesting. A friend of mine was recently in the hospital for gallbladder surgery, and he said he had a doctor come in who was the GI specialist that the surgeon had brought in. And this GI specialist only focused on the right upper quadrant. That's it. That's all they did, liver, gallbladder, that's it. If you wanted to know about the intestines, that's another person. So I thought that was really crazy. I knew they were specialists, but I didn't realize how special. And then of course the last thing is prevention, finding balance, creating balance in your life again so that you can prevent this disease from happening to you. The next thing I learned, and then this was an additional kind of supportive to that, is Samuel Hahnemann. Anyone heard of Samuel Hahnemann, the founder of homeopathy? So we learned about him in school and his philosophy of healing. And he says the physician's highest calling, their only calling, is to make the sick well or healthy, to heal as it is termed. The highest ideal therapy is to restore health rapidly, gently, and permanently. Permanently. Heal permanently. I never heard that before. That was a game changer. So then the last thing that's important here is that there is an order to healing. Healing happens in a certain order, just like the disease process happened in a certain order. So unfortunately in conventional medicine, we start at the top. We go right for the high force interventions, the surgery, the medications, the injections. They're synthetics, they're suppressive. They're not working with the body. So in naturopathic medicine, we see a different order of things to restore healing. We start with the foundation, which is, in my mind, it's illuminating their story, understanding the why. What is going on that's out of balance that we need to focus on. And once we know that, we can start to stimulate self-healing. And that's where some of the neuroscience comes in, that we're going to talk about. So, neuroscience, why is this applicable? Well, we know that all pain is processed in the brain, right? We used to think there was a pain center in the brain, but there's actually like 44 different areas that are involved in pain. So it makes sense that we want to utilize neurology and neuroscience understandings and therapies to interact with that pain and shift things for someone. So pain isn't just a signal, right? It's an experience that's colored by how you view your world, how you view things. Every sensation we feel is interpreted and then either amplified or reduced, depending on whether the brain believes that we are in danger or we're safe, right? So the neuroscience research has shown that chronic pain has less to do with tissue damage and more to do with the brain being stuck in this pattern of old danger responses. And that's called neuroplastic pain. So that's really what we're dealing with here when we're dealing with chronic pain, is that neuroplastic pain. The brain is stuck in this danger response that doesn't really apply because it's learned to expect it. It's that fear that comes up, and so we have to protect. So how do we teach or rewire the brain to heal chronic pain? Well, these are the things that I use, and I'm sure you all have your other tools that are really wonderful, but this is what I use in my practice. So we do a lot of conscious breathing, which is very, very powerful to interact with the brain and rewire those patterns. HRV coherence training, I use heart math for that. Beautiful, easy thing that they can learn and then take home and do. There's different energy psychology techniques like EFT or tapping and NET, neuro-emotional technique. Guided imagery can be so powerful. And then perception reframing biofeedback. So let me show you a few cases of how I put these ideas into practice. So case number 1, 31-year-old female lawyer and bar studio owner, so she's a very busy lady. She presented to the clinic with nerve pain, cervical pain, history of traumatic brain injury, scaphoid fracture, unilateral vestibular atrophy, anxiety, and depression. At her first appointment, we started with her story, which she'd never done. So we sat down together and we went from the time she was born up until the present and documented the main events in her life. And what we discovered was that she had a significant history of being bullied in school and sexually assaulted twice in college. She also had episodes of disassociation as a girl, and she had stayed in a dysfunctional, abusive relationship due to financial security twice. So what we took from that story, what she kind of came away with, is that we discovered that she tends to act out of survival, right? She doesn't want to do that, but that's what she's doing. She's acting out of survival and necessity rather than out of joy and her purpose. And so she came to the understanding that this was from a lack of trust in herself and a lot of fear. And so what we did together is I recommended a flower elixir and a digestive enzyme, but I also did some breath work with her, and she was to do that at home and do some journaling and gratitude practice. Well, as I said, she's a busy lady, so I didn't get to see her for 6 months. But 6 months later, she had absolutely no nerve pain, and her overall pain had reduced significantly. And she no longer takes gabapentin or Zoloft. That was huge. That was huge for her. Number 2. So 70-year-old female with rheumatoid arthritis. She's married with 3 grown daughters, and she is self-employed. She had RA when she was 12, but 15 years ago, the RA had worsened. And especially in her hands. Her hands were really bad, which is what kind of brought her to see me finally. Because she was up to 12 naproxen every day, and that still wasn't doing it. She was taking the medication for RA, sulfasalazine, 500 milligrams 3 times a day, and she still was suffering. She's been married 34 years, but she described her marriage as benign neglect. Not a great way to describe her marriage, I thought. So she said they kind of coexisted as housemates. So her husband is a very high-functioning physician with Asperger's syndrome, but she felt constant judgment and resentment toward him every time he'd walk in the room. And as we talked about her husband and her story, I noticed that her hands were like fists, like she kept clenching her fists. And I brought it to her attention. I said, did you notice that as you're talking about your husband, you're like this? She's like, no, I didn't know that. And then she said, you know, when I go to sleep, I sleep with this under my pillow. And I thought, that can't be good for your hands. And she agreed. She's like, yeah, that's strange. She didn't make the connection. And so we started talking about that. And of course, we worked on some physical things with her. We did a stool test, and so we found she had some infections. She had 3 different infections of Candida, mold, and Clostridium. So we were treating that. But I also did a few sessions with her of EFT and NET in the office, and then she did a lot of her own work at home. And through that process, 6 months later, she was doing really well. The pain was way down. Her hands were much better. She was down to 1, maybe 2 naproxen at night, none during the day. And she was able to reduce her prescription medication to only twice a day rather than 3 times. So that was huge. But really, even better than that was she had reframed her marriage and her living situation and was looking for alternatives that felt good to her. She was setting boundaries. I mean, you could see her. She just blossomed. Yes, exactly. She was blossoming. It was great. And then later after that, she told me she was taking up painting, which she'd always wanted to do, and she was traveling more. I mean, it was so exciting. So number 3, here's a young person, 23-year-old, college student. I've been working with her for a while with this upper quadrant abdominal pain that would come and go, and we had pretty much got it where it was gone, but it had flared up again, and she wanted to talk to me about it because it was pretty intense. It was 7 out of 10. And she'd been off her diet, as college students do. They eat poorly, and she was actually in grad school, so she was under a lot of stress. And but as she was telling her story, she was speaking in very harsh terms about herself. She's kind of a type A personality. She has a high bar for herself. And so this wasn't good. And so as we talked about it, we discovered that she believed the return of the pain was a punishment for having gone off her diet and enjoyed some pizza and enjoyed some snacks with her friends. This was a punishment. And so it spiked her pain, right? And so I took her through a process of conscious breathing and guided meditation and body awareness, because this is someone I've been working with for a while who hasn't really been able to connect with herself. She's been kind of closed down, but she's made huge progress in that area. So that we were able to make a shift in one session was pretty phenomenal. So at the end of the session, she was down to 3 out of 10 pain from a 7 out of 10. And she felt much more calm, but even better is she reframed the pain. She didn't see it as a punishment anymore. She saw it more as like a learning opportunity, as a way for her to be reminded that she needs to take steps, and she can learn from those, which she felt was really reasonable and something she could do. So that was pretty exciting. All right, the last case, 22-year-old female, newly married. She works full-time for USPS. She recently had a new onset of severe fatigue, like she couldn't get out of bed kind of fatigue. Frequent panic attacks, which she'd never had before in her life, severe daily migraines, and constipation, which she had been dealing with since childhood, was getting worse. So her mother was present for the visit, and so we talked about her story, and everything kind of started when she started this job, which was a full-time job working the night shift. And as she talked about it, a lot of fear came up about her finances, being able to afford things. She did, just thinking about the manager caused her anxiety, like she could feel that anxiety and that panic start to come up. And she was afraid of leaving this job because she needed the insurance to pay for her medical bills that she now had because of this job. and so when we talked about that, and her mom was like, yeah. And it was great that her mom was there because she was so afraid to change, to leave the job because of whatever reason. Her mom being there gave her that feedback that her mom was like, it's okay, that makes sense that this job is hurting you. And so we did some breathing to help her and some heart focus breathing and a round of EFT. I gave her a few supplements and dietary recommendations to address some of the constipation issues she was having. And we had that very honest discussion about her job. So 2 weeks later, I get this email from her. Hi, Dr. Dooley, thank you so much for checking on me. I am doing great. I'm finally feeling like myself again. I think I've had only 1 migraine since we last talked, which is amazing progress. Also getting my energy back and feeling like a 22-year-old again. And after she talked to me, the day after she quit her job, she said, I left my job the day we talked, and I really think that was the root cause of what was going on. These past 2 weeks have been, these have been the best 2 weeks I've had so long. I've been taking my vitamins every day, drinking water, barely had any sweet tea, and she's had a bowel movement every day. Whereas before, that was almost unheard of, right? And so she's seeing things kind of moving in the right direction finally. So what I've come to understand, as we talked earlier, pain brings up a lot of fear, but we shouldn't fear pain because pain is personal. Pain is good. Pain is always real, and it is your teacher. It is there for a reason. It is your protector, and above all, it does not like to be ignored, right? Do not ignore pain, or it's going to keep coming. It's going to grow. Exactly. So I've learned this on my own journey and with working with people with pain. And so what if you get stuck in chronic pain and you just can't get out of it? I'm sure you guys have had clients or patients where your normal, wonderful modalities and your care usually helps people kind of find their way out of the pain. But sometimes the pain is so intense, so traumatic or traumatizing that they can't touch it, that they are so disassociated from their bodies that they can't feel it. So what do you do when you have someone in front of you like that, where it's just, they don't want to be re-traumatized, right, by the pain. So I love this quote, because this is what we're going to do next. Dr. Bruce Lipton talks about the moment you change your perception is the moment you rewrite the chemistry in your body. And this is what we're going to do. We're going to change perception of the pain and help them see the pain differently. And how do we do that? Well, let me first give you a case example. So this woman's 53 years old at the time. She has a history of severe abuse, sexual, physical, verbal, emotional abuse throughout her childhood. Her current diagnosis is dissociative identity disorder, diabetes, type 2, insulin dependent, chronic back pain, and recurrent major depressive disorder. So she presented with chronic back pain, 6 out of 10 intensity, and the pain was localized to a spot in her mid-back and along the broad line, which is where she has felt it before and it had flared up on her. So we started with the EVOX, which is a perception reframing biofeedback that I'm going to share with you. We started with that, and as we were going through this biofeedback, a memory came forward. She remembered her older brother, who was her abuser, throwing her down the stairs when she was 16 or 17. She had completely forgotten that this has happened. And the pain that she felt when that happened was exactly where she was feeling it in that day. And so this was a completely forgotten memory. And when the memory first came forward, she felt a lot of helplessness. She felt hopeless, and she felt that she did not matter as a person. But as we continued with the biofeedback and she continued to kind of process that memory, what started to happen is she started to see herself in a more powerful position. She started to take her power back. And then she just walked away from him. In her mind, she just walked away. Her pain started out as 6 out of 10. At the end, it was 1. Just barely there. That was huge for her. So what is this EVOX perception reframing that I'm talking about? So this is a type of biofeedback. This is the hand cradle, uses galvanic skin response, kind of like a lie detector test. And in fact, you cannot lie This thing will pick it up. You can't cheat. I've tested it. I on occasion use it and I said, okay, don't tell me what your issue is. Just think about it. And then just count numbers. And sure enough, would you believe it? It picked up on what was going on. I reported to her and she's like, yeah, that's, she never did tell me what her issue was, but the feelings, the emotions, the thoughts were there. And they listen, and there's a microphone, so they're gonna speak. So the way eBox works is using your own voice. It's, you're gonna speak about your issue or not. Like I said, you don't have to, which is the nice thing. If someone is stuck in that chronic pain and it's like, I don't wanna go there, they don't have to go there. They can just think about how they're feeling or an issue that's going on in their life. And they can talk about that, or they can talk about whatever while they're thinking about their issue. And so this is gonna bring forward these subconscious limiting beliefs that we have. And you guys know, if you work with psychology and mental health, that the subconscious is really powerful, more powerful than the conscious. So then eBox, the program is going to create a voice map. It's not recording the words, it is recording the frequencies, the sounds, the notes that that is in their voice as they talk. So think about it, if you say to someone, so how's your day going? And they're like, fine, it's fine. Do you think their day is going fine? Mm-hmm. No, I mean, you can tell, right, in their voice, they're like, they're having a bad day. They're not like, yeah, my day is great, it's wonderful. Now you know they're having a good day. So you can tell in the voice. And so the software picks up that energy fingerprint, and it figures out where there's stuck energy or where there's a lot of energy. That's where it's stuck. And so it's going to feed back in frequencies that will help to calm that down and bring it into balance. And then you're feeding that back to the person while they're listening to music. And so that helps their nervous system reorganize around a new perception. It opens them up to a different way of thinking, and it deepens their awareness of themselves, which is pretty cool. So this is kind of the output that you'll see. It's divided up into 12 zones, which is reflective of the octave, all the notes in an octave. And each note represents a different emotion or belief, attitude. And so then you can use that information to feed back to them to say, are you feeling this, feeling that? Does this make sense to you? And they can kind of run with that. So it's really fast, 30 seconds, they're gonna speak, and then they're gonna listen to music, and then we're gonna repeat that process until the program shows a good shift in their energy pattern. So once that shift occurs, it means that their perception has shifted, whether they know it or not. They may not feel it, but in their subconscious, it has shifted, and that shift is permanent.
How long does that normally take, that shift?
The shift, it can take anywhere from 5 repetitions up to 12, depending. And so, that might take 30 minutes at the most, maybe an hour. Just depends on how much talking we do and that type of thing. So it can go very quickly, especially if they're very open to it. So the woman that I presented before that did the eBox, this was her recording at the beginning. So what came up was, so the red means highly intense energy, the green is much lower, and blue is even lower. So it's kind of mild and low. So she had a lot of stuck energy, intense energy in the zones 8 for fear, related to fear, and 7, anger. But also she had stuck energy in this zone for being self-critical. Like this action by her abusive brother was her fault, right? Like she believed that, but it's something she did. And so we worked on that, and at the end, it took about 8 recordings, and you can see things shifted. So the anger is still there, but it's less. But this was completely gone. She went from seeing herself as the reason, the cause of the issue, to loving herself and taking her power back. So that also allowed her to have no pain. So there was a huge shift for her.
What did you say the gray means?
The gray is the where there's energy and where there's not. So it's the computer doing its analysis. All right, so before I take questions, I just wanted to offer to this lovely group of healers and caregivers, because I think it's so important that we are all supported. We're all, especially these days, if you have an issue or you want to experience eVox and see what it's like, and then maybe, you know, it would be another tool in your toolbox, I'm happy to be that practitioner for you, but I would like to share it with you, and if you would like to have a complimentary session. So for this month, if anybody wants to reach out to me and take me up on my offer, then I'd love to do that for you. So thank you all for your attention, and any questions?
Can this be done remotely?
Yes. Yeah. They just need the hand cradle. So I can go back. So this piece here, they have to purchase that or rent it from me, and then they need a PC. Unfortunately, it doesn't work with Apple, so they have to have a Windows-based computer, and then the headset with the mic. Yeah, it works really well. I do a lot of remote sessions. Yeah.
Did you ever hear, there's two Harvard fellows that they read years back, and it's kind of, but this was a long time ago, it's called voice assessment. It's a 15-minute session that the psychiatrist does. You know, but you're doing it and you have the glasses.
This also can have glasses
And
with it.
and the ears. I'm just wondering if they haven't taken it so far that they have now, this company, but
Well, this technology has been around since like the 70s.
yes.
And it started with the studying of sound, and it came from, you know, the whole lie detector test is based on the same technology.
Yeah,
And-
because I had the voice assessment therapy in Tulsa years ago. And it eventually actually came from these Harvard psychiatrists because they kept helping folks. But, you know, you'd go back home and visit, well, then that child syndrome would come back, and then, you know, years and years they would be doing therapy and they couldn't quite get to where, and so these fellows that were the professors then started this voice assessment, but it's the same hand,
Yep.
and you're getting that, and but they had you think of like maybe 1 or 2 events or persons, you know, it could be grandma or, you know.
Yes, and you can
Right.
do transgenerational work. So if they have, like this woman that I presented, we have done that. We've gone through and done an eVox session on her mother, on her father.
Right.
Even great-grandparents, which maybe you don't even know those people, but there's a memory there, you know, that travels through.
Well, and that's
they
family
can-
constellation,
exactly,
is it?
yes.
Yeah, because
So-
all those therapies.
And I find that you don't need the exact words, you don't need a
Exactly.
particular process. You just allow whatever comes to happen, however it needs to happen.
Because you know, your healer knows. My whole thing is your body's communicating with you.
Right.
But it's been, your communication has been so far
So
down,
this is a
taken
really
away
nice
from you.
way to help someone who's so shut down
Exactly.
that they can't connect. This
They
allows
don't
some.
know how.
Right.
And just working with just the person with that therapy and journaling is great, but too many people can't do that, where this is something that's manual, you know.
Well, that's why I wanted to present this to you
Right.
guys today,
It's
just
a great
because,
idea.
you know, this modality isn't for everybody. And
Mhm.
so, but it gives you another option for your people.
Another tool
It's
for the
another
box.
tool, right? And
Mhm.
so it's nice to have all these different modalities because this doesn't work for everybody. EFT doesn't work for everybody. I had a person I did EFT on, and she's like, I feel like I'm beating myself up. I don't like that. But she
couldn't
liked
get to there.
this.
Right.
She liked this, and it worked for her. So that's why I wanted to present it to you today.
Yeah, very
Yeah.
nice.
How often do you find that people's pain is stored in like some childhood memory that was traumatic? Is that pretty common?
Yeah, usually it's the deeper stuff, right? So if we clear the top, the stuff that's right at the surface. You go deeper, it's connected, yeah. You know, all my issues are my mom. I mean, just blame her. I'm good. Yeah, Alicia.
I'm just curious if this is something where, like, if we wanted to incorporate something similar like a biofeedback, is there like an app or free something patients can download to do this themselves from home?
Not for this.
Anything like it?
Gosh, I don't know if there's anything like it. So the software, just so you guys know,
Yeah.
the software license is $11,000. The equipment, the hand cradle is like $240 for the hand cradle. So it's kind of, you know, it's not a good price point for most people, which is why
It's a
I'm
big
offering,
investment.
because I want to have more people using it. Take advantage of my license.
Right. Well, isn't that what we all do to each other?
Right.
Because it's like, who are
Well,
you?
in a kind and loving
Yeah.
way.
It's but it's, who are you and where did you come from?
Yeah.
Because if I can help you to know who you are and where is it and where are you, and if your body can communicate, that's the intuitive part of me. Is my business is intuitive healing. So, but you have to find that intuitive self. You have to learn to listen to the pain. I love your pain sheet.
Thank you.
Because that pain is a gift to you.
Mhm.
And when they keep knocking those symptoms out, it will come roaring back until you listen, you know?
Alicia, I was thinking the heart map might be an alternative.
Mhm.
Because it's a biofeedback device that they can buy, and it's a reasonably priced device. And then they can practice, it gives them feedback on how they're breathing. And the breathing, conscious breathing is a great way to tap
Oh,
into
yeah.
the same stuff, right? So that is a good option. Good question.
What's that one called?
It's called Inner Balance. It's from HeartMath. It's an HRV coherence trainer. So that's a type of biofeedback that is definitely accessible to everybody. Yes, sir.
So you made an offer of $125 for us to experience it. What do you normally?
No, it's free for you.
Oh,
It's free.
Yeah.
Complimentary.
Complimentary.
I didn't see that.
Oh, sorry, it's free, guys.
I thought it was
I'm giving it,
$125 as well.
it's my gift. You too, Melvin.
It's normally 125.
Normally it's
$250 for Melvin.
It usually is about an hour. Usually about an hour. So what I find is about 5 sessions is pretty much all that's needed. If it's a real acute issue, they can clear that in one session. But if it's something a little deeper, about 5, maybe 7, is what I have experienced.
What helps you determine whether it's G or D? The
Yeah.
feedback.
Yeah, how they respond, how quickly they, go through this process. If it only takes a few readings and their pain is down or their issue is cleared, then that's all they need.
This is a probably dumb question, but
Never.
I've seen one, I think it's Instagram or TikTok or who knows, whatever it is. But the little videos pop up and it shows almost like a bell curve and it's trying to get you to breathe in rhythm with a little bouncy ball. And it's just these little free video apps.
Yes.
Is that in any way mimicking kind of biofeedback or teaching them to?
It is,
breathe in? Okay,
sure,
so I'm
because
not crazy.
biofeedback is basically, you're seeing something, it's giving you information back on what you're doing. So that breathing tool is a type of biofeedback, because they breathe and they follow the little bouncy ball. And so if they can follow it, that's telling them they're in rhythm. If they can't follow it, that's telling them they're out of coherence. So that is a type of biofeedback. Great
Thank
question.
you.
Yeah, absolutely.
Is this a common practice for naturopaths? And how did you discover it in,
I was working at a clinic in Scottsdale for a very short time. And the doc who owned the clinic, naturopathic doctor, he was into gadgets. He had all kinds of gadgets, all kinds of stuff, energy gadgets of all kinds. And this was something he had, and it wasn't really being used. And he had a hypnotherapist in the office, and she had brought it out one day and was using it with a client. And I'm very interested in mental health and mind body medicine, and so I was like, okay, you gotta tell me what you're doing here. And so she did a session with me, And I was hooked. I was like, this is so cool. And I said, why are you not using this every day? But she wasn't, you know.
No.
But after we kind of worked together, she was using it more and more, and it became more prevalent. But no, I had never heard of it until I was at that clinic. And I'm so glad I was there for the short time I was
That's
there.
exactly why you were there.
Exactly,
Because
exactly.
then that's what you needed.
Yeah.
Exactly, yes.
So this is helpful because, I mean, for me as a practitioner and naturopathic doctor, you know, I am not a psychologist, I'm not a, you know, licensed counselor, but I do a lot of counseling. But I know my limits, you know, I know my boundaries, and so this allows me to do that kind of care without having to be so involved in the therapy. They're in charge, you know, they're the ones doing the work, I'm just guiding them.
Now, do you do a printout to share with their PCPs? And, I mean, have you had that? Have you had any
Here's medication.
Yeah.
Looks like you're all out of whack here.
Yeah, well, but I mean, have you had that where you've had doctors, like say Honor Health Doc or any of it? And I'm asking because I just
Doctors
met-
don't like me.
Western medicine.
Well, yes,
Western, it fears you, is what it fears you. It's not that they don't like you,
Well,
but
I
it
don't
fears you.
It's a
Because
different
they
paradigm.
lose money.
Yeah.
But I know a few Western trained doctors that I'm gonna take a few things because they want to learn more. They didn't go to be a doctor to do what's out there now, you know, and so.
Well, that's why we're all here, is to learn.
Exactly.
Is to learn more and learn what's
that's
out
why I
there
wondered if
and
you had
share
that
our gifts.
experience, so, but you are open to that.
Oh, absolutely.
Okay, all right.
Yes, sir.
Any failures?
Failures?
I'm so
Oh, I'm
sorry.
perfect. Well,
Are.
yes, definitely.
Let's
I
be
mean,
realistic.
Yeah.
yeah, oh, absolutely. I tease, because, you know, we all have failures and we don't like to think about those, but yeah, actually, I have a veteran, who was remote, so wasn't someone I could see in person. So we were doing remote sessions with him. And the trauma was significant. He'd seen battles, multiple battles, and so we made progress, but of course, you know, I wanted more for him, wanted more progress. So definitely some things shifted, but not to the point of like the one I presented. You know, that was significant. Yeah, absolutely.
So
You know.
where do they go after that?
So I referred him to one of the things, and actually Alicia helped me with that, was he needed sexual counseling therapy, sexual abuse, not abuse, but addiction, thank you. And so I referred him to someone, and I also gave him some other resources. And so as far as I know, he's been going that route. I haven't spoken to him in a while. Yeah, I am very interested to care for the person. I don't care if they get that all from me, that's okay, you know, that's why we're all here, and we all have our gifts, and so if I can send someone to Alicia or someone to you for the love and connection and whatever that they might need that I can't offer, then I want to do that.
No, see that as failure,
No.
see that as a step towards
Collaboration.
success, it's like we figure out what doesn't work. and
Right.
stuff.
That's true.
Great work.
Thank you for that.
Well, thank you very much.
Thank you all.
All right, as always, we'd like to go quick around the room to share all the services we offer in the community. Barbara, you want to start today?
Sure. Thanks for your presentation. I'm Barbara Brown. I publish Together Arizona newspaper. It's a monthly publication for the community on behavioral health and addiction recovery. I'm also part of the CARE event in September for National Recovery Month, and that'll be September 20th. Details are still being finalized. And then I am a partner in the Bill Brown Memorial Golf Tournament, which is September 19th, and that is open to anybody that wants to come play golf or be part of it. And the proceeds to that go to the Arizona Women's Recovery Center in Phoenix that help women with kids. They have pregnant women, women with children, trying to get their lives back together. And It's a wonderful organization, and I'm also on the board, so that's it.
Awesome. Thank you, Barbara. Janice?
Hi, I'm Janice. Most of you have heard my story before. I'm a certified early screener. It's one of the services that the Mayo Clinic provides, and so you have it online. We have a great webpage to take a look at it. It also affects the brain. 90% of the brain is visual processing. So if you have Irlen syndrome, you have difficulty with migraines, with extended reading, with light, sensitivity. Kids in school, about 30% of them are misdiagnosed with ADHD or learning disabilities, and they actually have Irlen syndrome. Some states require that every student be screened for it because it's so prevalent with those that have learning disabilities. But for adults, it can affect you at any age if you have any kind of change in your regimen, medications. But the brain is lit up. It is lit up, and Dr. Emmett has proven that. It's lit up. And so it can cause immune system disorders, chronic pain, because your brain is always trying to process and filter light, which is color, and it's corrected through, I have little Irlen spectrum filters. They're worn as glasses, and they're different colors that they put on that correct the distortions. I screen for it, somebody else does, the diagnostician for the glasses. So I'm just here to get the word out about it because I'm an occupational therapist, and I found out about it, and it really, really affects people. And the people that I've helped have really been helped. So I'm here.
Awesome. Thanks, Janice. Kendra?
Hi, I'm Kendra Gipple, and I run a program called Hope Social, and it is for teens and young adults, and it brings them together to give them a place to connect and belong. So it's especially good for kids struggling with anxiety, social anxiety, depression, and loneliness and isolation, or kids that have been bullied and no longer have any kind of support system around them and need that connection. We all know that connection is vital for these teens and young adults, and isolation is the worst place for them. So I have a group that I run, and I do it as a coach. I have a background in counseling, but I'm doing this as a group coaching program as well as a support group. So they're meeting with peers and connecting with peers and doing life with one another and just reconnecting with each other and just with life in general. And I love what you shared today because I feel like I'm tired of people saying you can't heal, and I'm getting all these kids coming in thinking, this is my life. I've been diagnosed with anxiety, so I gotta figure out how to handle my anxiety or handle my depression. And I'm like, no, let's heal it.
Yeah.
Let's get through this time and support one another and get to the other side and just enjoy our lives and have a great life. So all those things you were talking about, that's like the same kind of thing that I'm trying to focus them on there.
Thank you.
Yeah, take them to the other side of this. Because our bodies and our minds and our thoughts and our, you know, it's so powerful.
Holly?
Okay, I'm Holly, and I'm a professor, and I teach nurses, and I wanted to bring this to them. I also think everybody, if you haven't done AIM, I'm going to do a commercial.
Oh, are you? Oh, thank you.
Yeah, for AIM.
Take as long as you want. Yeah.
All right. University. I'm a mentor for one of their programs. They have two. They have a brain health coach and a brain health trainer. I think the trainer's licensed, and one is certified. I get it mixed up because of a long story, but we're not going to there. I've done each one twice, and now I'm mentoring, and I'm just taking attendance. So please join so I can be busy, and it's really worth it. That's why I did it twice. I also have a doctorate in epigenetics, so that my college didn't even know what it was. They gave me a doctorate. And they asked, what are you doing?
Too late now.
Well, they liked my chair read my whole paper, you know, and graded it and stuff. And then when I talked about it, she was like, whoa, I didn't know this. Oh, you didn't read my paper.
She didn't
But she's paid you.
Kyle?
My name is Kyle Payne. I'm a licensed counselor. I'm trained in EMDR therapy as well as ketamine-assisted psychotherapy. I work with all adults, 18 plus and up, all genders. Obviously trauma-informed, so anyone dealing with anxiety, stress, depression, all symptoms of trauma. I'm a good person helping out with that. I do a virtual stress reduction hour workshop to help introduce kind of the real source of the stress, because it's not the stress, it's the trauma underneath it. Help people get some awareness and teach them mindful breathing techniques to help them work to sit in the stress or sit in the agitation instead of trying to get rid of it. So,
That's awesome.
Agnes Chow, I'm a transformational life coach, and I tell people I help them upgrade their human operating system by tapping into heart, mind, body intelligence. So I'm trained in several modalities, including Psych K, and I believe in having lots of different modalities, and I'm trained in several of them. But part of it is holding space, and you do that beautifully for your patients, and I can tell. And when you can hold space for others, then that stimulates their healing process to take place. I also have helped veterans who have had suicidal thoughts, and then recently helping somebody walk again. And so it's and it was really subconscious, at the subconscious level. And once you surface what those subconscious limiting beliefs are, then you can state what you want instead and transform the process. So so it's been an incredible journey, and kudos to you because I've done both the Amen trainer program and the certified coaching, and for you to teach and mentor others, that's amazing. So I also have a nonprofit called the Empowered Heart. It's all about educating people on strategies, tools, techniques for stress relief and self-defense training for women.
Ashley?
I'm Ashley. I work in transcranial magnetic stimulation. For those of you, most of you probably know what it is, but if you haven't, it's a non-invasive way to stimulate the brain for individuals who are treatment resistant with depression. So it's primarily for major depressive disorder. And again, we're just stimulating the neurons in the brain to help them wake them up so they can function normally. They are starting to use it for chronic pain.
Oh, really?
It just got FDA approved on some devices for chronic pain. So it's holistic, and it might be something that you're interested in, but this is awesome. I'm so excited to share this with my team. Thank you.
Hey.
Hi everybody, I'm Alicia. I'm a psychologist with the VA, board certified in cognitive and behavioral psychology. I also have a skincare business in the anti-aging industry through Dan and Fields. Both of those identities I've put together, and I've published 2 books, Don't Be a Stranger on Connecting with Strangers, Depression Management Skills and Tools, as well as Don't Be a Stranger to Grief for healing through grief.
That's awesome.
Yeah, thank you.
That's really lovely.
Hi, I think I just know about everybody. I'm done with Patrice. Been here learning. That's actually part of why I'm here, is so that I can learn the different modalities that you do, because I have so many modalities, and I'm very big on communication and empowerment, because if I don't know what I'm doing for me and I'm trying to heal, I have done that, where I put myself out there and I'm trying to help and heal all these people, and it's just kind of like, the more and more you do that, and the older you get and the more you learn, it's more, let me step out, but let me offer you this, and not take any of that. Like when you were asked, were there any mistakes or misfits, or it's kind of like, no, because you don't own any of that. That's really the person. And I want to empower you to say, this, I'm marvelous. You know, you've gone through so much of a journey, and I think we all forget we still are going through our own journey. You know, we have to take that time to do that breathing and that sauna or the massage. And it's like we get so busy being caregivers that we forget we need care. And when some little symptom comes up, we're like, oh no, wait, I got this, you know, and you forget. That intuitive is knocking at yours too. So it's like, I think kind of my thing is, remember that as a healer, you need to take care of you. Yeah, I think
So I
that's
hope you
real.
all will take me up on my offer.
Yeah.
Yeah.
Because I want to support all the healers in the room.
Do you have like an address or?
It should be on my card. Is it not on my card? I'm on Sweetwater and, that was, and near Paris, if you want.
Okay, because I have a few folks that I want to involve them. I'm the connector, you know?
They'll give you a call.
I already started there.
Yeah.
I'll take anything.
That's pretty much what I see.
And that's what I do. That's what I 25 years ago.
Yeah, so that's why we need all these modalities, because there's so.
How you doing? Are you doing? Are you still doing physical therapy?
I just said, I said, I think they have everything. Oh, yeah.
Oh, you can do that?
Not in a lot.
Right. Good for you. Hey, absolutely. Are you a community thing yesterday?
Well, wanting to get the word out.
It was like Tuesday.
Well, of the month.
I'll be trying to have one in April.
Thank you.
I'm at the point where I don't know what
They are, and you write so much on my sheet. And that's to me, no, wait, it's Mason. No,
It's a Tuesday. All right, I'll send you. Yeah, it's gonna be live recording, it'll be on TV. Yeah, we can send you some program. Ask them questions.
I hope your kids that are,
We train you.
I mean, I look
So
at
we'll be
my
on-
daughter, she's
So I think it's, I think it's the first Tuesday.
but now, I didn't know. I made them wait for the babies, but still when they give me it for real, like, you know, to ask you to sit down. But it was doing to their body, and it's started thinking it's harmless, you know, it's just like, it's not worth it. They're always trying to thank you.
No problem. You arrived the first week of June, so my kids in June. I do virtual PBS special, but it's going to be a PBS special for people.
So they know.
So they're gonna be there.
I think it's the first Tuesday.
Yeah, my son's still my son has.
It's gonna be on to the beach. TV is part of PBS.
That's awesome.
He's actually going to
Parents are on their phone.
It's all about
It's the weirdest.
Yeah, 4 or 5 stops on some. Italy, France.
Oh, wow. My wife and I always want to do a roll crazy.
Yeah, I would keep that in mind, and we're doing really good, so.
Depends on how she does it.
I am going in North
Yeah, it's a common piece.
it's from the 101
Golf injury, yeah. I know.
kids from Mesa, she had
So I said, race, you taught me race.
Nice to meet
I play with the pro teams and whatnot, so I'm 20, 30 yards faster. Oh, yeah.
You're a natural.
Oh, right, right, looking for the result. Yeah.
they want to sell, they should hire.
Yeah, what is the nurse exam? Because they, when I introduce it, people are gonna say, welcome, congratulations, but because the new people never say thank you.
Not always.
I'm going to.
Still.
Yeah.
Not many people, not many people get it right, but.
Server, the chefs, the sous chefs, all stuff. I know it's gonna sound, so much, it's not.
I usually end.